Hello, I am Dr. Satish Rudrappa, Group Director, Institute of Neuroscience at Whitefield, Bangalore. Today I'll be discussing on the commonest problem of the brain called epilepsy. Epilepsy is not a disease. Epilepsy is like a symptom. So what is epilepsy? In a common term, to explain to common man, epilepsy is nothing but an electrical activity which starts in one part of the brain and just spreads across. It is exactly like a lightning happening within your brain. And the electrical activity of the small part of the brain happens due to various reasons. It can be genetical, it can be related to trauma, or you can be developing some kind of infection within the brain, or it can be tumor. But today I am discussing on the epilepsy, which has nothing else happening within the brain, but when you take a picture of the brain and an MRI, it looks normal, but only abnormal electrical activity. That is a common way. In the common term, we call epilepsy, which is what the public knows as fits, the normally which is known. Or in various language, it is told in a different way. So this epilepsy, as I said, it comes from one area of the brain, spreads across. And usually it starts in the childhood. Many of the common things as a doctor, what I see in my clinic is, doctor, when my child developed fever at the age of 8 months, 4 months, 1 year, he had a small altered behavior, that is the beginning of it. And why does it happen? We all have a thermostat within the brain. When we grow from a childhood, from an infancy to the childhood, the thermostat matures, and even at the 103, 104 temperature, we don't react, the brain doesn't react to as an epilepsy. But as a child, when it's growing, the thermostat do not control it, and it spreads the electrical activity to the rest of the brain, and most of the children have an epilepsy. If untreated, this will continue as a frequent phenomenon. So when it happens, the frequent phenomenon, you require a medical help. So there are different types of epilepsy. For a common man, when somebody throws hand rigorously, stretches body, eye rolls up, the froth comes out, and the bleeding happens in the mouth, which you can see in the common way, is an epilepsy. It is a classical epilepsy we call generalized tonic-clonic epilepsy. But this happens in about only in 30 to 40% of the patient. Whereas in children, many of these things you see as a simple phenomenon is like just a staring for a few seconds or lip smacking, which happens, which many teachers think that the child is staring at the teacher in an abnormal way, and in the school he'll be abused for watching the teacher without her making eye-to-eye contact abnormally. Or some children behave in such a way that they suddenly wander around picking the things in the air. These are all what is called as complex partial seizures we call, which arises from the temporal lobe most commonly, but which is a very common seizure in children. And in some patients, suddenly they drop. It's called drop attacks, which is myoclonic jerk, which is very common in abnormal brain development happen in infants. So in essence, what I mean to say is there are different variety of seizures. But if most of these seizures will give an abnormal conscious state for lasting for few seconds. But it another way is we call focal seizure. Focal seizure means if somebody has an abnormality in the motor cortex in the brain, only one hand can move, finger twitches, or some patient face twitches. So that is coming from one focal area. In general, we divide this into a generalized epilepsy and a focal epilepsy and a complex partial epilepsy in a common term. It's not for the medical education. For medical education, we do it in a different way. For a public, these three categories happen. So once you see somebody who is falling in the road with a full tonic-clonic seizure, he requires the medical help. A child staring at the teacher with a lip smacking lasting for less than 30 seconds requires some medication and medical help. And patients who are having a focal fits is the one who requires medical help. So epilepsy doesn't differentiate the age, doesn't differentiate the sex, definitely doesn't differentiate gender, race, creed. Everybody can get whoever has a brain can get the epilepsy. So if you have any of these things, please visit the medical doctor for further care and management.